On a global scale, mental health is underfunded and lacking in many resources. Lack of accessibility, lack of funding, lack of resources, and the power of the stigma prevent many people from ever receiving the help they truly need. Welcome to Normalize the Conversation. I'm your host, Francesca Regeter, and today I'm joined by global mental health advocate and mental health consultant, Glenn Roil. Glenn currently co-chairs the Global Mental Health Peer Network, is the recipient of the NAMI 2022 Lionel Law Ridge Champions Award, and the recipient of the 2021 Human Rights Champion Award for Mental Health from the Governor of Newfoundland and Labrador. Join us as we discuss some of the current issues within the global mental health system, from a lack of funding and accessibility to stigmatization. Glenn, thank you so much for joining me today. I am really excited for our conversation. But before we dive in, I really just want to check in with you. How are you really?
I'm doing very good. I appreciate the reach and sort of thing at all. That's a good way to reach out to people, and I think something that we really need to do more of, that we've learned through the pandemic. How you may all look great on the inside, out on the outside, but on the inside, you're very much challenged tremendously. So pretty good. Hopefully you're doing as well, Fran.
It is so important that we do check in. You're absolutely right. I am doing well. Thank you for asking. I started playing tennis recently, and I've just hold on, I have it written down. My 18th day in a row. I have it on a whiteboard in my room. 18th day in a row playing, and it's been a way to just help with my mental health, because I get so frustrated and overwhelmed and anxious in the advocacy world. I love it so much. It is so fun to talk about mental health and to be working every day toward a better tomorrow, but seeing all these areas that need improvement every day and just wanting to grab the world and shake it and just fix it all, and you can't. For me, it gets really overwhelming. So I recently started playing tennis as a way to, instead of wanting to hit people who are not putting funding toward mental health, I can hit a tennis ball instead. So I'm feeling really great. So Glenn, before we talk about that lack of investment in mental health and what we need to be doing, I wanted to hear from you. What inspired you to start changing the world?
Absolutely. I'll get into that. I'll just say, for my own kind of self-care wellness, is kind of country music or having a good conversation with a friend, or just outdoors, being a part of nature, is very therapeutic for the amount of work, the advocacy, and the involvement I have. As I guess I eat, breathe, and sleep this, but at the end of the day, I got to take care of Glenn's wellness and Glenn's mental health. What inspires me, Fran, is that I've had my own lived experience with mental health. I've dealt, I think, with anxiety and a bit of OCD, obsessive compulsive disorder, when I was much younger. I'll give you kind of a bit of a nutshell, is that I had a grandmother who raised me for the first number of years of my life, and she was always my certified rock sort of thing at all. But going up through school, and I had challenges kind of fitting in with my own peer network sort of thing at all. And then I think I had that official diagnosis of generalized anxiety and obsessive compulsive and social anxiety. Wouldn't think today, for the amount of work and speaking engagements and people I'm involved with. And, navigated through some of my youth and my adult challenges with certain aspects, and then I had some significant milestones or major changes that happened into my life, where I lost my father back in 2004 to a brain tumor. I was only 59 at the time. But then I lost my grandmother to heart the year later in 2005. I always keep saying, based on your age and demographic, kind of either your 9/11, JFK, or Pearl Harbor Day happened for me back in 2008, and it was a changing point of me making change. So out of this kind of negative experience, I also picked up another mental health disorder, being post-traumatic stress disorder at all. And through that, with great support of community and certain families and great friends out there at all, I've moved forward stronger than ever. And just want to make sure, as I keep saying, I want to live to be 100, so that's a number of years yet to happen, that I want to say that Glenn left the world better than when he came into it. So this is my passion, this is my purpose. I think faith and God plays an important part of my wellness and my recovery as well.
First of all, Glenn, I am so sorry for your loss. My heart goes to you, but I'm so impressed that through all of that loss, through all of that kind of mental health, I mean, it's really been recently that we've started talking about mental health. So I can't imagine growing up I mean, growing up for me, we didn't talk about mental health, and I'm in my 20s. So I can't imagine growing up with all these different things happening and not necessarily having that space to talk about it. Funding was even less back then. So to see how you've been able to take all of your different experiences and turn it around in a way to leave the world better than you found it is absolutely incredible. And I hope you know that.
No, thank you very much, Fran. I appreciate it because, again, a bit more older than you at all. I kind of hold my age for what it is at all because I still have a very much, I may be in my 40s, but I feel like I'm in my 20s over time, sort of thing at all. And, due to the fact that when I went through my most difficult, some immediate of my family members very much turned their back on me. So I really know who I trust in this world going forward and who I don't. And I'm glad that I have the core people around me that I call, as I keep saying, my honorary family. You can have you can be born with blood, but you pick and choose your friends and your honorary family, sort of thing. And back in the day when, like I say, a bit older than you, that it was kind of something locked in the closet and, keeping all those skeletons versus, having that open discussion. And again, investment wasn't there. The peer movement wasn't there at all. The recovery model wasn't there. It was all very much medical. So I think we all can learn from each other at all. And thank you for your kind and generous words.
Absolutely. We all can learn from each other. And there's so many amazing changes that have happened in the past. I mean, I want to say like 5 to 10 years. A lot more conversation, a lot more stigma reduction, a lot more willingness to invest in mental health. Now, is it enough? No. Is it a starting point? Absolutely. And am I proud to see that that's happening a little bit? Yes, but we've really seen, like you said, that medical model switching to that peer support model. Both are so important, and bringing them together is, I think, essential. I think peer support, I just had a conversation about this like 10 minutes before this, how important it is to kind of diverse and have that peer support because people with lived experience really have so much value at the table and for that to never be undervalued or undermined. So I am really excited to talk with you about that lack of investment in mental health. Now you're coming from Canada and I'm from the United States. So we have some similarities and some differences in the ways that our countries are approaching mental health. So I'm really excited to kind of look at both perspectives and find what we should be doing or could be doing better, those opportunities for improvement.
Absolutely. We can have a conversation on that. And I'll just kind of piggyback on what you kind of said around that whole peer movement perspective sort of thing, because these and people beyond the mental health or the mental illness sphere, if you're dealing with heart issues or diabetes or any other aspect of life at all, there's a lot of that peer movement also being incorporated. And I always keep saying, we have all may have come through different circumstances or different situations, but we have that common thread that pulls right through it all. So like we can all kind of learn back and forth at all. And I always keep saying, reserve judgment as much as possible, because the old adage, you don't want somebody to kind of pick and choose on what you've been through at all. And I think the other part that's also lacking, Fran, if we can have a conversation, part of beyond the investment, is the personal responsibility, the resilience and the accountability, not just to companies and governments and organizations, but the individuals. It's the old adage, you may have had this or developed or come through a traumatic event, but it's also your responsibility to get better. And that only goes so far in life at all, because there's people who come out even worse scenarios and have built successful lives. So I always keep saying empowerment at all, but you also have to figure out, what's your part of the overall wellness and recovery and, where you want to take your life. And some people may have less engaged life because maybe their illness or their situation, and so like again, it's not the judgment thing, but one step forward. I've kind of said like many times, like people may just be able to get up and have a shower or eat, and then there's others that can move the world like yourself and I are moving, sort of thing. So again, it's based on each individual thing, but forward momentum is better than stagnation.
Yes, it's so important that we take our mental health into our hands when we can to really empower ourselves to take that first step. There are so many things that also prevent people from taking that first step, from the stigma, from the lack of conversations, from not knowing what's available, for not having the funding, not having the structural resources, just so many things that are impacting people not knowing where to start or what to do, which is why I love having these conversations, why I love bringing people on from around the world to talk about what they've done. Because the truth of the matter is therapy is very inaccessible for so many people for so many different reasons, whether it's a structural barrier, internet I mean, telehealth is great, but if you don't have internet, you don't have access to a good Wi-Fi network that can process therapy, then it's really difficult to even access telehealth. Funding, a lot of therapy or therapists don't offer insurance, and that goes into why our insurance companies require so much time and paperwork that therapists can't even take enough clients on, or they're spending more time in paperwork and trying to justify to the insurance company why someone needs support instead of being able to support them. Are insurance companies declining people from getting help or only giving them 6 to 10 sessions a year? So there's so many different things that are influencing why people just aren't getting the help they need, the lack of resources, the accessibility. Everyone, no matter who you are, you deserve to feel loved, to feel supported, to feel enough, and to have a happy life, right? We all deserve it. And we all have the power to take that first step. Sometimes we just need to know what that step is, or have access to a conversation that can tell us what steps are available and have more funding put out there so that more people can access it when it is financially often very difficult.
And I think you made a very good point there, Fran, is around the vantage point of one of the people when I first got involved with the whole mental health movement and change in our country and in my province, or our province, is that everybody needs a place, a job, a friend. So like, I mean, whatever, a safe and affordable kind of living situation. And then from a job, some people can work, some people can volunteer, whatever purpose they got. And everybody needs a friend, if it's a partner, if it's just a friend sort of thing at all, to get through with this. Because if any of those one pieces are out of alignment, your mental health is going to go one way, shape or form. So I really like you bringing up that point. And around the barriers thing, because being in Canada versus the United States, and I know you guys have rural parts within your state and your country, broadband is a big issue when you're dealing with things, and big telecoms won't put investments unless they're getting their return on their investment. So I know that internet, I think the UN or the WHO has made a statement that internet and cellular and mobile phone coverage is as vital as electricity or food or housing sort of thing. So it's so critical that we really need to invest in and not put people on wait lists, because I keep saying, if somebody had a cardiac event today, would they be offered to put on a wait list and then be sent home to use a website? And it's all great that there's more information we had than years ago, but like I say, from my generation or your generation, is that at the end of the day, some people can text out a real story, but then some people feel more comfortable just having that conversation. But what I kind of said is that the head and the body isn't disconnected. So we take one aspect of healthcare and then, look at the other part sort of thing at all. Let's continue this conversation.
Yes, it's so important. I love that point on the broadband. I recently got my own phone line. I think my dad is so excited to not be paying my phone bill. It's probably the happiest moment of his life. So I recently got my own phone bill, and I learned that you can pay extra to be one of the top people to access it first. So if everybody is on their phones in the same area, by paying extra, you can be the first one to have the best cellular network. I don't really know the exact terminology for it. This is all foreign to me. This has been a month of me having my own phone bill and understanding how much things cost. Wow, no idea up until that moment. But when I realized that, and I was like, okay, I'll pay that extra amount because it's really important to me to have access to internet at all times, because people do reach out to me. My work is really important to me, my email, school, telehealth, all these things. And I was like, okay, I don't mind paying the extra. But then it dawned on me that not everyone can afford the extra. Most people don't have that free budget to be let me spend $130 a month on my phone bill so I can talk to people whenever I want. I can be the first person to send a text. I have priority in texting. And I think that it's so important to realize that not only are there structural barriers to that broadband, but there's also so many different financial barriers that a lot of people can't even access that quick enough internet to be able to do the research online to see what's going on, to call a friend, to call a helpline, to text a helpline, to do a telehealth. I mean, a lot of these resources that we kind of send people to and we tell them are available, we're not even often paying attention to that financial piece of how much it costs just to be able to get on the internet and figure out what to do.
Absolutely. They're all talking about equity and accessibility. Well, if people don't have the basics, it's pretty hard to have access to services that they need for their overall wellness.
Yes, and I know that during the pandemic, that was really brought to national attention because suddenly kids are online for school and so many kids don't have computers. So many kids didn't have internet at home. And although that's something that should have been common knowledge that we all should have known and like thought about before, I know that that was never something that I was thinking about in my head because when I went to school, our school gave us iPads. We had the computers. It was never like a question to me on whether or not I was going to be able to do my homework online at home. And then suddenly we're hearing about it during the pandemic. And I was like, wow, so many people can't access simple things that I can. I'm bored. I can go online and play solitaire. Like it just never occurred to me, it came across my mind that this was an issue. So with the pandemic, we did see, I know there were states that did it. I don't know if the federal government did anything for it, but I know there were specific states in the United States that put more money toward making sure that kids had access to computers and had Wi-Fi because this is a big deal when people can't access the tools that they need to continue moving forward.
Absolutely, because maybe I was a generation as finishing up the high school experience as we were just rolling out the internet back in the day of Vice President Al Gore he said the forerunner for internet, and like we always can as older people kind of say it's just amazing what kids are doing this day and age that they can take things apart and put it back together in no time. But again, like our country, our governments federally and provincially were offering the iPads and some of the Chromebooks to students, so they at least they had access, for their education piece, because that was the other part that was failing it too. Because if people are falling apart on an educational standpoint at all, that's going to affect their overall quality of life, their mental wellness, their ability to interact and do post-secondary or getting involved with the labor market, employment opportunities, sort of thing at all. So it's so critical, and it's something that I think everybody needs to engage their elected representative, if it's from a municipal or a state, provincial level, or from a federal level at all. Because I know within the stats within our country, they're saying almost 10 million Canadians, so that's about a third of the country. And I mean, you can extract that out to the United States, or a billion from a global standpoint, or 3 billion from a global standpoint, sort of thing. So it's a public health crisis. Our chief medical health officer from Canada said it all, and I'm assuming similar to your country.
Yeah, absolutely. It is a public health crisis. It's something that no matter where you are, no matter who you are vulnerable to struggling with your mental health, because just like our physical health, we can all get a cold. We all can get a cold. There's no way okay, maybe not no way, but I personally don't think it's possible to go through your entire life without ever getting a cold, right? Like maybe it is possible. So I shouldn't say like it's not, but it could be. I've never heard someone saying I've never gotten sick in my life. So back to my point, we're all vulnerable to getting sick sometimes or to not feeling great sometimes, right? And the same with our mental health. I mean, life is full of so many stressors. Unfortunately, with life comes death. We lose people. Unfortunately, with love comes loss. We lose relationships end, friendships end. With happy comes sad, right? The ups and the downs. I mean, there's like with jobs, you can lose a job. There's so many things you can do bad on a test. There's so many things that can happen that can stress you out, that can affect how you're feeling. Just this core wound of feeling not good enough when you're online comparing yourself all the time, right? There's so many things that can impact how you're feeling. We're all vulnerable to having, whether it's just those days where we're really struggling, or if it becomes a diagnosis or just repetitive symptoms. We all are prone to struggling at some point with our mental health. And yet, in the way that we access physical health, there's often not as much priority around mental health, not as much conversation. I mean, if I broke my arm today, I wouldn't be afraid to go to the hospital. I would go and get an x-ray and then get a cast and then go back to the doctor. I wouldn't be like hiding my arm in secret so no one would know. But with mental health, if I'm struggling with a depressive episode, I'm a lot more inclined to just hide away and pray no one knows and just put a smile on my face and pretend like I'm fine, right? It is a public health crisis. It is a global public health crisis because we are all vulnerable to struggling. It's completely normal. It's part of the human experience in some form or another, but it's not given the same respect and time and energy and effort and funding as other pieces of our health.
Absolutely. No, you hit on some very credible points there, Tal Fran, is that governments need to really start to put this investment in at all and make it a priority at all. Because the other aspect, and I'll go back to that in a second, is I do a lot of work from a company based in Canada called Stigma Zero around workplace mental health. And again, people spend 2/3 of their life in a workplace setting. And so knowing how to interact with people that are struggling in from a manager, from a HR, from a senior leadership thing at all, and any of your viewers or listeners would love to engage some of the work that we're doing, because we're dealing with some American companies as well, or a global player in this, feel free to reach out. And as the aspect, if somebody went out to have surgery or hip surgery, for example, or cardiac surgery, when they go and visit their loved ones in a healthcare setting, oh, the flowers, the cards, the chocolates, the teddy bears, all the great stuff is offered, the hugs, the kisses. But if somebody's having a major mental health issue and they end up into one of the psychiatric facilities in this country, your country, around the world at all, it's all kind of kept in the closet. And versus, the candies, the hugs, the teddy bears, the flowers should be brought in there at all to kind of equal that playing field at the end of the day, because there's so many people that are struggling. And again, goes back to some of the work I'm doing around social determinants of health, is that if one of those spokes are out from basic stuff, from housing or internet or food security or income or loss of a job, loss of a partner at all, anything can potentially slip somebody over at all. We all have a sense of that anybody can fall down this ladder in terms of falling apart if they don't have the basic necessities of life. And we really need to know that people have the ability to have the support around them, because if they don't, again, from a public and a health crisis, as I've said to many prime ministers and premiers in my country, and many of your governors and your presidents from your country, is that it becomes a public safety issue, because people are going out and committing crime to try to cover their basic necessities of life. And then, they're ending up in the justice system and corrections, which is costing taxpayers lots of money, versus doing this prevention. And I always keep saying, the leader of our provincial opposition always keeps saying, many governments are very reactive versus proactive. So why don't we be proactive about young people, or women that are just maternal, out of the gates sort of thing at all, and our youth and our middle age and our seniors at all, because you don't know where along that continuum of what circumstance could trigger a major mental health episode at all. And talk about it, because the more people talk about it, the stigma will be reduced, versus just keeping it hidden. Like you made a great example about a broken arm, you wouldn't hide it behind the back of your head, versus if you had a major depression situation sort of thing. So, we have to make it a normal conversation of any other health concern that happens in life.
Yes. Oh, and I really want to go back to what you said in the beginning about how in the hospitals, there's these cards, there's flowers, there's teddy bears, and you go into the psychiatric facilities and there's none of that. Now, I understand their concern with D and being very careful on what materials do go in and out of the psych wards. I respect whatever the right laws are for that and the right protocol, because we don't want to put people in dangerous situations. However, there is no reason for there to be completely beige walls, caged windows that just all you see is a cage, you can't even see the sky, for dim lighting. Someone's already feeling really dark in their mind, right? Like, you're feeling so dark inside. At least for me, that was my experience when I was in the psych ward. I was in the darkest of thoughts, and then my environment was dark and plain and beige. That was the most unhelpful environmental space to be in, because I didn't need any more darkness. I just needed some light. I needed some color, something good, not just feeling so dark. And that was why I started the encouragement card program, where we hand out cards, because it was just trying to bring some kind of color and happiness into the psych wards. But it's so true. When someone's sick, they are in the hospital, we want to bring them flowers and candies and chocolates. We want to do all these things. But when someone's in a psychiatric facility, we often, as a society, kind of push them away, don't necessarily want to go visit them. We might refer to them as crazy, and just be like, oh, I'm just not into that. Like, they're on their own. And that sucks. Like, it really sucks for how many people don't get that support that they need solely because of a stigma. Because there has been I don't want to say there has been no effort, but there has not been enough effort in putting more funding towards psych wards to bring more light and support and make them feel more supportive, more bright, like there's hope. and not like, right? Because right now, in my opinion, and this is my opinion from my experience, I feel trapped. I felt completely trapped in there. And what I needed to feel was hope that there's a better tomorrow out there. So I don't think that there's been enough funding pushed to even bring light into the psych wards. And I don't think there's enough conversation pushed on why it's important to visit your loved ones or who may be in a psych ward and what conversations you can have with them. Because let's be honest, how do you even know what to say? If you've never experienced it before, you have no idea what's happening. You have very little knowledge on mental health. And someone that you love had just attempted to end their life or at imminent risk of ending their life. What do you say? What do you say? When there's been no conversation to prepare you for that moment, what do you say? And I know for my loved ones, they had no idea what to, and I think, needs to be more funding put toward education in our school systems, in our workplaces, everywhere. That's just, here are validation statements. Here's how you can validate someone. Here's how you can offer supportive statements. Here's how you can encourage and empower someone. Here's how you can help them access resources, what you can do. Here's open-ended, non-judgmental questions you can share. Here are things you can say. Give people a starting point, because like we've been saying, it's difficult. It sucks to be in a psych ward. There's no other word, honestly. Like, it is not a fun moment in your life when you're hospitalized because you don't want to be here and it's dark and it's gloomy. And if you don't have that support that you need in that moment, it's a lot harder to get out of that dark space.
Absolutely. No, you're singing to the choir there, friend. I mean, we have one of the oldest psychiatric facilities, which is now finally being integrated in terms to our major health science here in Newfoundland and St. John's. It's called the Waterford Hospital. It's had a very bad term, even though Waterford has a really glowing from an Irish and an English standpoint. And I can tell you it dates back to 1855. So a very old building now we're finally replacing and putting that wing new state of the art. And a quick story on that: back in the day when King George VI and the Queen Mother visited Canada, because we were still part of the British, one of the colonies. We weren't formerly part of Canada. They didn't want to go buy the facility, so they had the contractors at the time build a ramp or a side road up sort of thing. It ended up named the Road Deluxe, was done by, I think, French contractors. But at the end of the day, you look at the drama and the situation that the royal family has played out, no different than what Princess Diana dealing with eating disorder. Prime example, I mean, our Prime Minister's wife, Sophie Trudeau, has done the same thing with the Prime Minister's wife, Margaret Trudeau. I mean, they've all been very vocal about it. So, like, this issue about really saying that why should we separate physical and mental health wellness and recovery? Because when people are at their lowest, like you say, looking at dark cages and dark walls at all, look, safety and security is an important aspect. It goes to a larger issue about, at the end of the day, I know we've adopted, I think, from your place in the US, a Phoenix model for mental health crisis recovery with police and health authorities. But for the longest time, no different with Black Lives Matter and the other issues about how people, their first interaction when there's a call is to the police or law enforcement. And when people see somebody with a gun or something, that's only going to escalate their issue versus de-escalate. And another quick story to the American viewers down there, or your world viewers, one of the southern ports inside Newfoundland back in the day, there was a call, and an RCMP officer from the Royal Canadian Mounted Police was brought to a situation, and a colleague with the fire department advised him to put on the firefighter and went in and de-escalated. So a simple thing like that can really change the perspective, because again, health should take the lead. Public safety is important, but it should be the last resort at the end of the day. Again, a lot of these unmarked vehicles are moving with this. It should be at the last resort at all. I mean, we should be treating this. I mean, if somebody had a cardiac event, will we call the police and have them escorted into the hospital? Or if they had a broken arm, like you were saying, it's the same thing at all. People have emotions. So, like, we need to get away from trigger mechanisms, and governments really need to start the funding, because I know in this country, we're somewhere between 5 and 7. And in a lot of my global talks, I think I state Australia, New Zealand, I think Germany and France, and some of the Scandinavian countries are world leader. Around 14% of their health budgets are into mental health. So I think Canada, US, and other countries can do better due to the fact they put billions into energy companies and subsidize a lot of corporate welfare across the board. At the same time, some of the citizens are so vulnerable, don't know how they're going to be or they're going to lose their life to suicide at the end of the day because they have lost hope.
You start redistributing funding. Point of calling the cops, that is often the thing people think of because they don't, right? Well, what if there was more thing on DS, right? People often don't know who is episode. Maybe they're having a psychotic episode and they grab a knife. They don't deserve to get shot down when maybe there's another option, right? Like de-escalation training. Now, I'm not saying that people's lives should be in danger because we're not interacting the way we need to. I'm saying find the best way to interact and know that there's other options. It doesn't need to go straight to shooting someone down, which is a thing I've seen one too many times on the news. So putting more money toward de-escalation training for our law enforcement. So when someone's automatic response is to call the cops have the support and tools and resources they need to be able to handle that situation. I've seen a movement in the US where they want to bring social workers out with the cops too for mental health. And I think that's really great. As long as, again, we're protecting someone's safety, they have the resources they need. I think that's a really great option, assuming someone is comfortable in that situation. I think there's a lot of great options, and it really comes down to doing better job funding. You said just doing a better job in funding, because do we have all the answers? No, like we don't have all the answers. Like we can't sit here and pretend like we do, but we have answers on how to move forward, how to take that next step so we can empower people so people can start moving forward and getting the help they deserve. And a lot of that goes into funding into the behavioral health facilities and into the hospitals for psychiatric resources, into our law enforcement so that there's de-escalation training, into our school system so that prevention's being taught at an early age. There's so many places that we could put more funding to start working toward finding more solutions. And yet we often sit here and wonder why the suicide rate's going up, as if we don't have starting points.
Absolutely. And I know we've taken some of the Phoenix model from the US and incorporated with law enforcement to have psychiatric nurse, social workers, or peer support people or peer support specialists to be part of that integrated team sort of thing, and then actually connecting them to the tools and the resources that they may not know that's in the community, so they can get their proper treatment or their wellness plan put together, sort of thing. It's incredibly knowing the amount of smart, educated, well individuals, how we still seem to not, maybe Hollywood has done the work over the years about everybody with a mental illness or a mental health concern or a challenge are violent, and maybe Hollywood also going to take their degree of responsibility. The same thing with the news at the end of the day. I understand, what bleeds is the old terms back in the day at all, and I think it's still today. But we should actually say that, like, if somebody was having a cardiac or a broken bone or another issue, would that make the news, sort of thing? And so I think we need to have media training. We need to have the de-escalation training, as you were talking about, that's been pushing here. Something that I've done in terms of some of the training work as a mental health first aid that has come out of the work of the Mental Health Commission of Canada that, went to your country and around the world. Getting that, because we do through St. John's Ambulance first aid training. Why don't we do this? And the same thing in terms of suicide prevention. A lot of great work doing with LifeWise and LifeWorks in Canada at all. Like, the more the tools, that are at people's disposal when somebody's having a break with reality or a mental health breakdown, at least they know how to interact with somebody versus having a complete panic and having no support. And then the thing escalates so bad, they either end up dead, badly hurt, badly bruised, their confidence are shaken, and they may not be able to work or have successful relationships. So what cost does that come to the governments and to society ultimately at all? Versus if we had somebody that was a mental health first aider, knowing that this individual, John or Jane in your company or your organization, here, let's come and have a conversation, let's have a talk. Do you need to go to the hospital? Do you need to talk to somebody that's working in the peer movement at all? Do you need to see a counselor? What kind of support? And I think it goes back to that education piece from day one. I mean, what about mental health at an early age, sort of thing? Healthy relationships is all interlocked, sort of thing at all. And I think the more that we understand the dynamics and the behaviors of people, we'll be able to raise up the next number of generations more successfully than we've done over the previous years and previous generations.
Yes, and going back to the media training, it's another one that we need more funding to. It's so important that we pay attention to what we're saying it, how we're reporting it, and also the way we're depicting. When we show someone, a character on TV or in a movie who lives with a diagnosed mental health disorder or condition, we often see the very extremes, right? And although the extremes do exist, I think we need to see more of some moderate cases, some mild cases, some untreated mild cases that become more severe, pieces in the middle, things that worked and things that didn't. I think that there needs to be a lot more mindfulness going into the content prepared, because unfortunately, I remember watching a TV show and the character had bipolar disorder, and whenever the character had a manic episode, they would be hurting people. And I just thought that that's what bipolar disorder was. So when I got diagnosed with bipolar 2 disorder, I was like, oh no, I'm now a threat. I'm harmful to people. I am not a threat. I'm not harmful to people. I can't even kill a bug. Like, I wish I could kill a fly, but I'll just cry about it instead and scream and leave the room and say that a fly can have my apartment. I'm very good at the whole adulting thing. Can you tell?
Absolutely.
So it's really important that we're paying attention to the messaging we're putting out there and being mindful and investing in media training, because you don't know until you know. Honestly, like, you don't know until you know. But now that we're seeing things, now that we're seeing these warning signs, now that we're knowing, let's put more money into educating others so that we can continue to move forward. Glenn, I cannot believe this conversation and time has gone so fast. As we are wrapping up, what are some action steps or advice you have for someone who wants to get involved in advocacy, who wants to get involved in making sure we have more funding, who wants to get involved in conversations? What advice or action items can you offer them so they can do some of the amazing work that you're doing?
I appreciate that. I'll just conclude on your little last statement. If you guys would like to look in terms of how media in Hollywood, Rain Man back in the day, Dustin Hoffman, I think a gentleman that had autism, and A Beautiful Mind, I forget who the actor was in that. There's some kind of movies that actually did good portrayals, and maybe Hollywood needs to kind of push on that. But from the vantage point of what action plans that people can do, number one, have open and honest conversations with your loved ones. Because people can't read people's minds at the end of the day. You know, they could look perfectly great on the inside, out on the outside, but totally falling apart on the inside. Another part is that bring it up to your elected officials, from your municipal to your state, provinces, and your federal governments at all. Get involved with any organizations in the community that are promoting mental wellness and mental health awareness sort of thing. And the various action days coming up now this month in May for Mental Health Month and mental illness. In October, and in Canada we have a Bill Let's Talk back in January that Bell Canada has undertaken. Get involved, use social media for the benefit, because that's the other part I think that has destroyed a lot of perspective, is that I think we all kind of do that comparison online. And I think that can also trigger major issues in people at all. Because again, I always say, because we're all guilty, we can all put up our hands at all, that perfect picture just before Christmas, 5 minutes before and 5 minutes after, people are fighting like cats and dogs. So take it all with a grain of salt sort of thing. It's a great enabler, but it also can hurt a lot of people that aren't. So sometimes be cautious in what you post online sort of thing. So at the end of the day, engage your employers to get mental health and suicide intervention, or the work we're doing in terms of Stigma Zero, in terms of workplace mental health. Reach out. There's lots of resources, lots of people like Fran and I that are trying to move this conversation to a better and a more encouraging outcome, so everybody has good quality of life and good mental health and wellness for their life.
Glenn, you are absolutely incredible. It is so important that we recognize that what's posted on Instagram, what we see of someone walking down the street who's fully put together with that big smile on their face, may not reflect how they're feeling. Like you said, having those honest conversations, it's so important. For those of you listening, check in with your friends today. Ask them, how are you really? Not just how are you? Don't make it a greeting. How are you really? Check in, because we all deserve access to support. And be honest. Be honest with your loved ones, because if they're asking, they care. Glenn, thank you so much for joining me today. I had a great time talking with you. Thank you so much for listening to Normalize the Conversation. Don't forget to subscribe, rate, and review. This podcast is an initiative of Inspiring My Generation, focusing on normalizing the conversation, bringing education and awareness to the forefront, and amplifying global voices to spark change and hope. Inspiring My Generation is a 501c3 nonprofit organization on a mission towards suicide prevention through awareness, conversation, education, and support. Connect with us on Instagram at Inspiring My Generation and visit our website inspiringmygeneration.org to learn more about our work and how you can make a difference.